as we're designing new innovations for healthcare systems, it's critical that we think about inclusive design and how we're co-designing with the people who we're designing for in order to come up with the best ideas possible and in order to have the best impact that we can on the context. When we talk about insights for innovation, we're often talking about how do we build empathy with our stakeholders? How do we understand their needs? And how do we understand their perspectives so we're designing things that matter to them and are meaningful to them? But one of the challenges is that empathy could often be really shallow. So I can go and spend 3 hours with a NICU nurse, and I think I understand who he is and where he's coming from, but that might not be true. And then empathy can be used to justify making decisions for someone else on their behalf. And then finally, in an attempt to get a project done, we're often not inclusive about who we're building empathy with. Often it's the people who we have the easiest access to and not necessarily the most important stakeholders in any situation. And we want to do our best to avoid some of those pitfalls. We want to do our best to really build empathy with all of the potential stakeholders and really understand their points of view as much as we possibly can. And one way of doing that is being really explicit about our humility in a situation. So even though I might be the designer, you might be the clinician who knows the most about this problem, there's so much that we don't know about the context, about the situation. And so we need to acknowledge that which we don't know. We need to acknowledge the limits of our own expertise and acknowledge the expertise of the other people who we're involving in our design process and invite them to co-create. So as I was coming up in design schools, I would always hear about empathy is about walking in another person's shoes. And in some ways that's true, but I love this quote by Oveta Sampson that really challenges that notion. Oveta says that empathy is about having your behavior, bias, and power dynamics dismantled before you can even begin to understand another's subconscious thoughts and motivations. You don't walk in their shoes. You take your shoes off and let their journey change you. You have to recognize their human existence first, value them as a person before you begin to express empathy. And to do that, you have to let go of yourself. So this is something I want to challenge us all to do. What do we need to do to set aside our biases, our preconceived notions, whenever we're walking into a room with people, whenever we're trying to understand a situation? How can we metaphorically take off our own shoes so that we really can understand the situation that someone else is in, so that we're really designing something that matters for them and we're designing with them as much as possible? One of the mottos of the disability movement has always been nothing about us without us. And what this means is disabled people want to be involved and engaged in anything that's designed for them and anything that's done for them. And I think this is true for all people, but it's especially important when we're talking about people who might have less power than us, who might have historically been excluded from processes. We need to work extra hard to think about how we're including them in a process and how we're designing with instead of designing for them. And one way to do that is co-design. So co-design is a shift from designing for someone to designing with them. And it's about really opening up the innovation process to your end users and engaging them in creation. And often that involves creating accessible tools for collaboration and making. And always that involves inviting them into the process as equal stakeholders at the table. In their book, Design Justice, Sasha Castanja talks about how you can map degrees of community participation across the design phases in any project. And in the book, they talk about a process that's similar to our double diamond process with empathize, define, ideate, prototype, and test. And they acknowledge it's not always possible to get a high degree of participation across every single project in every single phase. But the goal should be, over time, to be increasing that degree of participation so that it becomes more of a strong level of participation and more of almost a governing level of participation, as opposed to just We talked to somebody here, we talked to somebody there, but then we went and made our decisions. So one thing to talk about is in your portfolio of innovation projects, how are you making sure that you're leaning in towards more inclusive design and more co-design? And how are you making that happen at different parts of the design process? A couple of great examples of this can be found out there in the world. There's an organization called Open Style Lab, led by a woman named Grace Jun. And Grace works with people with disabilities to help them design mostly fashion products for them that are more accessible or adaptive to varying abilities. And in one of her projects, she collaborated with teenagers with disabilities. And what they did was first they started just understanding what their needs are. And one of the things that they learned is teenagers, they wanted more pockets. And they wanted pockets in different places than maybe other teenagers might want pockets. And so she worked with them to create a kit, an adaptive crafting kit, so that the teenagers could create their own pockets on their own clothes wherever they needed them. So it was this process of figuring out what their needs were and then figuring out how to help them address their needs. So it's empowering for the end users, and it has the result of they end up with these amazing pockets wherever they want them and wherever they need them. And they feel powerful because they've created those pockets themselves. Open Style Lab also works with large corporations. They did a project with IKEA where they had the designers from IKEA collaborating with designers and people with various abilities in order to improve things as varied as, how do you design a towel for a woman who can't move their hands, to really thinking about how do you set up a bathroom environment for people who might have various abilities. And what I think is amazing about Open Style Lab is Grace uses this approach of co-design both to provide better solutions to the participants, but also to teach people like IKEA designers how do we think differently about the populations that we're designing for and how do we be more inclusive in our approach. This example in the medical community is a story of an architecture firm that was designing a hospital system, and they used inclusive and collaborative design to co-design with clinicians and various people who were working in the hospital. So as you can see, they used a combination of foam core and existing Playmobil toys, and then they 3D printed some of their own objects to help think through what is the flow through a space and how do we get the people who are using the space to help us design the space so that it really meets their needs as well as possible. Another great example of co-design happened in the spring of 2021 when Penn Medicine collaborated with Mercy Catholic and community leaders in order to roll out a vaccine collaborative so that they could get more people from the community around Penn Medicine vaccinated faster. And you can see evidence of a collaboratively designed process when ideas are taken from wherever they come from. So it was community faith leaders who said, why don't we get vaccinated first and get vaccinated publicly? And that was implemented immediately. And so everything that was done was brainstormed by this group of people who had varying expertise, understanding of the medical situation, the public health situation, and the community and their needs. And so they designed this really strong community outreach effort where vaccines were delivered in neighborhoods with really easy sign up for vaccination that targeted these specific populations that the community leaders were a part of. So as you're thinking about co-design and making sure that your innovation projects are as inclusive as possible, you need to think about who is involved in the process, who has a seat at the table, how are they showing up at the table, and how are you showing up at the table to really make sure that you are including their perspectives, that community members have as much say in the project as a clinical team might, in order to make sure that you're really designing something that has the kind of impact that we want our innovations to have. A couple of other things to think about are being really clear about who's participating. So not relying on unmarked participants. For generations, most medical research was done with men, and we assumed that everything that we learned was relevant to other populations. And we now know that that's not true. So being clear that you're articulate about, we did this research with white men, or we did this research with Black women, and making sure that you're including all of the different populations that you need to be including. You want to also think about intersectionality. So most of us do not just have one identity, and those multiple identities can impact how we show up in any given situation, our experiences in any given situation. So make sure you're paying attention to that and really finding the right mix of participants that makes sense given the project. One of the things to note is this can slow the process down. It's not always easy to build relationships with the participants who you need relationships. It's not always easy to get everybody at the table, but it's worth taking the time to do that. It might feel slower in the short term, but it's gonna help your project move faster in the long term if you have the right people sitting at the table. So don't get stuck in the trap of we need to move quickly, so it's okay for us to not have as much community engagement or to not have the kind of representation that we want among our collaborators.